Hey guys, welcome to another one of our additions to learning about Marpe Wellness and the different equipment we have and what we're capable of and how we're going to help people out. I have to apologize, just got a cold on Sunday morning and fighting it off naturally with just doing some natural things with nebulizing with infinite iodine, and then also silver bullet and bright eyes. So I've been going back and forth between those, and then just lots of fluids, vitamin C. What else?
Some rest.
Rest. Yeah, Melissa.
Lemon water with some honey.
Yeah.
So.
Melissa took over all the clients on Monday, so I got a chance to rest and try to get better. If I tried to talk to you guys on Monday, you wouldn't even got this much out of me. So, anyways, I'm getting better. I'm not perfect yet, but handle all of our clients today, and I got my energy, which is great. I just have this raspy voice now and a cough, which when I get a cold, I typically have a cough that lasts for weeks afterwards. So.
And typically in the past, you've always been on antibiotics. He's always had to go because he gets some really bad lung infections. So this time around, we're doing it au naturel.
Yep.
And
actually, she asked me the other day, she's like, "Has this been the best cold you've ever had?" And I had to laugh, but I'm like, yeah, it has been. Like, typically, all men, you get a man cold and you're the biggest baby in the house.
I was so dreading the man cold this time around, but it's been pretty good. He actually chopped up all the veggies for salad tonight, so it's not that contagious. And I'm still super healthy, so what does that say about all the nutraceuticals we take?
Yeah. So, anyways, tonight we're going to talk about cardio med bed. So we've had the cardio med bed since July 2023. And we had tons of people on the bed since then, but I made some notes here. I kind of wanted to make sure I don't miss anything. I know I've had some questions already. I'm going to address those questions as well, but I'm just going to kind of give you a history on the bed. It is made, you can see this, ACS. They're the manufacturer and the company that we were able to buy the bed from. They've got some incredible technical support, sales support, everything. Like, they've been hands down one of the best companies to work with addressing questions in a timely manner. No, I don't. Oh, it's over there. So, anyways, the bed was actually invented in China in the 1950s. So it's been around for a while. The reason it was actually created in the first place was to help the doctors to not cut into people, but help with any cardiovascular issues. So it was produced specifically for cardiologists. And when they brought these beds into the hospitals, first of all, the doctors didn't believe it could do what it can do. But secondly, they weren't even considering using the bed. Instead, they would circumvent that and go straight to, here's your option, it's surgery. Now, this is the information I've been given from ACS. This isn't my own information, my own beliefs. This is directly from ACS. So a lot of patients didn't even realize they had this option to work on this cardio bed and clear their issues instead of going under the knife. Circulation is the key to good health. And with good circulation, you can fight off anything and pretty much everything out there. Because with the circulation, you get oxygenation. And with the oxygenation in your blood system, it just helps you to combat any diseases or viruses that are trying to thrive in the body. When the blood has oxygenation in it, that's the most powerful or not anti, but most powerful.
Well, it's like an antioxidant. I mean, you need the oxygen in your blood in order to live properly. I mean, living is oxygen, right? So to keep all of these cells healthy, they all need to be oxygenated. So
yeah,
this machine definitely does that.
Think about it this way. You can live without food for 3 weeks. You can live without water for 3 days. But you can only live without air, oxygen, for 3 minutes. So clearly oxygen's of vital importance to surviving and thriving in this world. So yeah, oxygenating your blood can help with so many different ailments out there, and this is kind of why we're trying to educate people tonight, is just opening up those doors, opening up the minds, so people can reach out to us. And I'll throw our phone number out a few times. You can reach me at 403-200-3133 or email us at inquiries@marpaywellness.ca. So getting into that part, the diseases and inflammation is all due to lack of oxygen in the body. These cuffs on Melissa here, so she's got a set of cuffs on her calves, another set on her thighs, and another one around her buttocks. And they're all Velcroed on, and there's a hose. You can't quite see the hose, but I'll turn you, hang on. So there's these hoses that go to each cuff. And from there, we start the machine up, and you can see how things turn out. So I'm just gonna finish strapping her in here. Just had a few extra Velcros to add on. And then we're going to start up the machine, and you can see how it responds.
So right? hopefully everyone will be able to still hear us talking when the machine kicks in, because we do have the fan on as well, so it does make it a little bit noisy in here.
Yeah, well, that's why I put the mics on.
Yeah.
Okay, here we go.
Your coughing is louder when you cough into the mic too.
So right now you can see there's, when the air goes into the cuffs, she kind of like lifts off the table a little bit. It's not uncomfortable. It might be for the first time or two until you get used to it, but we pressurize these cuffs. They start off at about 1.5 psi, and then it grows from there, and it'll actually you want to get up to 6 psi and maintain 6 psi pressure in these cuffs while the machine is running. Ideally, your treatment time, we want to get you up to about 60 minutes, but that takes time. Most people, their first attempt is roughly 15 to 20 minutes. And then the next time is 30 to 45. And by the third time, most people have no problem doing 1 hour. And again, we don't push you to get to the 6 psi. We watch and listen to how you're reacting, how you're responding, how your body's feeling. The main reason these cuffs are inflating is to squeeze the blood from your lower extremities. And if you look close, you can see this one inflates first, this one second, and the one on the buttocks third. So it's squeezing the blood up to your torso, to the core of your body, and that's something that, otherwise naturally your body's not going to do. So the biggest benefit of this happening is the blood's being pumped upwards. So if there's any blockages, most of the blockages are going to be on that side of the blood vessel, not the blood vessel that pushes the blood down the leg, but the blood vessel that goes back to the heart. I'm just keeping it simple because I'm not going to kid anybody. I'm not as smart as some people think I am, and I like keeping it simple rather than using all these fancy words like the doctors do and confuse everybody. So if I'm too simple, then find somebody else to follow, but I really don't care. I'm not going to try to learn all these fancy vascular words and this and that. Melissa knows them all. You can ask her. So anyways, this is pumping and going through the blood vessels, and it's actually pushing the blood back to the heart. That's typically where the blockages are happening, on the way back to the heart, because it's not being pumped as the same way. It's not under the same pressure. So this is where the blockages happen, and this is where, when it finds a blockage, the body itself on its own will actually either work its way through that blockage and clear the blockage safely, or most of the time, the body will actually create a new blood vessel around that blockage.
Like a micro artery, isn't it?
Yeah. Yeah. So it'll create a micro artery around that blockage. So that's important to understand, because most people don't understand, and they're concerned like, well, if I get on this machine, I have a blockage and it breaks through the blockage, now I have this issue of all of this crystallization or the whatever
Calcium deposit
the
or
calcium,
whatever,
yeah,
kind of floating around in the body.
and then it can get into my heart and puncture my heart or puncture another blood vessel somewhere else, but that's not the case. The body actually protects itself and creates the new artery, the new vessel around that blockage. So, oh, here's an interesting fact. So, when your body is starving from oxygen, actually, I'm just going to shut this off, guys. Now you got the idea. So, and I know you can't see it from here, but on the monitor, we're watching the ECG, the pulse, and then the middle one here, it's basically the heart when it's pumping versus when it's sucking the blood back up. So we see all that. We get the full disclosure recording, your beats per minute, your heartbeat per minute down here, so we can track that and monitor that. So if somebody their heart rate starts escalating because of anxiety or anything like that, we're on top of it. It's a very safe procedure. One of us is always here or within earshot, because there are alarms, as you heard some of the alarms go off when I shut it down. So these alarms let us know if anything's not working the way it should, and it gives us a chance to correct it without stopping the procedure.
Yeah, absolutely. Like, there's no way to outsmart this system. We can't shut the alarms off. We can't, just get people to continue on at the pace that we want them to go without the alarms going off. It's a pretty smart. Now it's super quiet.
Like I said, I'm not that smart, and I can use this machine by myself, on
You
myself.
could even, he sets himself up.
Granted, we don't let our clients do that, but it takes care of everything. So it's kind of nice that way. So starving from oxygen. Here's three different things that ACS told me about that you got to be paying attention to. And it's people with dementia, inflammation, and or disease. These are all issues of your body starving from oxygen, from O2. So if you can improve your oxygen in your body just with this, using this, then you can turn around and reduce the inflammation, first and foremost, which will help you to fight any disease and eliminate that disease potentially with just this, not saying only this, but it also can fight dementia. I'm not going to say that it can cure dementia. We don't cure anything. The body does everything. We just help.
Just help facilitate the body's ability to self-heal.
So being on the bed for an hour, excuse me, is like a 3-mile jog. So for those athletes out there that love running you used to work with somebody who would run, what, 20 miles a day?
Yeah, something like that.
So she probably looks at this and goes, well, that's boring.
Totally.
But here's the difference. There's no wear and tear on any of our joints while we sit on this bed. There's no wear and tear or damage to any tissue within our body or our lungs from overexertion. You have to run 3 miles at a high rate to be equivalent to the exercise you get on this bed. So that's something that you can't get anywhere else. Best exercise you can get while laying down. I know some of the guys have disputed that with me, but let's keep it PG here, guys. Couple other things. Oh, here's a cool fact. So COVID, ACS had 50 patients that did a test with them, and they're actually doing another one right now with over 100 clients. But COVID patients typically had brain fog and shortness of breath. So after 37 treatments on the bed, monitored by ACS, the symptoms of long COVID disappeared. Long COVID is blood clotting, blood stagnation, and that's the two big things that people see along with the shortness of breath and stuff. So what would you think about restoring your body back to pre-COVID, whether vaccinated or not? That's what this bed is capable of doing.
And it's not even COVID. I mean, I don't believe I've ever had COVID, but just, some of the symptoms that I had prior to using the CardioMed bed. I mean, I didn't have great lung capacity. I mean, if I really tried and took a deep breath, I could, but I always felt like my lung capacity wasn't exactly what it needed to be. And brain fog, I think I used the bed maybe 12 times, and I just noticed a difference in the amount of oxygen that was reaching my brain. So those are things that were noticeable to me. But we also in our clinic have a really fantastic test that we do on our clients, and it's something that I performed on myself back in April when we first got it. It goes through the body systems, and the very first thing that it tests for is the cardiovascular and the cerebrovascular system. And in mine, I was really surprised to see that I didn't have great cardiovascular health. I felt like I was a pretty healthy person. So back in April, some of the numbers that I had, like my myocardial blood demand was actually very elevated, meaning, there was a bigger demand for blood to my heart than should be, given my age. Another thing was the brain tissue blood supply status was very, very low, meaning I wasn't getting proper blood flow to my brain. So there we go. There's why I have brain fog, maybe why my memory, wasn't as good as it could have been. So, besides doing the cardio bed, you can work on things like that just by, practicing deep breathing, meditation, yoga, things like that really focus a lot on breath work. But for me, this was fantastic because while I'm on the bed and while these cuffs are inflating, I'm really focusing on my breath, and I'm focusing on allowing more air into those lungs and holding it. And of course, if I held it too long, the alarms would go off. But this was my exercise to really be able to increase my lung capacity. So I did about 12 hours on the CardioMed bed before I decided to do another one of these tests. And I was pleasantly surprised, actually, that my numbers normalized completely in every category that was tested. And I think there's about 15 different categories under the cardiovascular and cerebrovascular report card here. And all of my numbers increased either to be normal or decreased to be normal. And so to me, that was like, it was amazing. It showed me that this machine does what it says it's capable of doing. And not only that, I mean, I can feel the circulation in my feet. I've always suffered from really cold hands, cold feet, cold heart, some might say. but after only a couple of treatments, I mean, I could feel the blood, rushing to my feet and coming back up. I could feel, again, getting off the bed after the first 1 or 2 treatments, I could feel tingling in my back. I've had surgeries and didn't realize the blockages that I was dealing with and how those blockages and the scar tissue had affected my overall circulation. So, doing the cardio med bed has brought back blood supply, through the pelvis and to the lower extremities, and I just feel so much more energy. Just it's been fabulous.
And we've had other clients tell us similar things, like even after one treatment, one client said like she had so much energy for the next couple of days. She'd never experienced anything like this before. Yeah,
it does. People that have that lethargy, that are just always tired, it's a lot of times it's just a lack of oxygen to those tissues throughout the body. Like all of your body systems need oxygenation. And if you have stagnation, that's the other thing that I remember a Chinese medicine doctor telling me years ago, that I had really, he called it black blood, and it was basically his way of saying stagnant blood. It was kind of, it wasn't moving, it wasn't getting oxygen, so it ended up being black. And just by incorporating this piece of machinery into my daily routine has really changed my energy levels and my oxygenation, for sure.
And so with that as well, historically clients, not just with us, but that use these beds, they restore their circulatory system. So they have improved energy, which we talked about. They have improved health. They're happier, and they have increased life, increased just vibrancy, want to get going. And then there's this other one, weight loss, which kind of shocked me. But think about it. If you got better circulation, your body can now fight off the fat. It can burn those calories efficiently. Think about an old like furnace or an old fireplace that, it gets all that soot in there, and then once it's got all that in there, excuse me, in the chimney, you either have to clean it out or watch the whole thing burn up. Well, your body's not going to burn up, but it's going to diminish its activity level. It's the quality of life you're going to have.
And it doesn't burn up, but it kind of shuts down.
Yeah. And then, of course, you end up packing on more weight because your body's burning up on the inside, so the inflammation kicks in and fat makes you fat, basically. So, anything else to add to that? So, this bed here came from a hospital down in the U.S. All the beds that I know of have come from the hospitals. And you're probably asking, well, why wouldn't the hospitals keep them? Again, it goes back to the surgeons don't get paid to put people on beds and not cut people open. So they're not doing what makes them money.
They're not doing quadruple bypasses and stents and anything else when they're using these.
And multiple clients from ACS have said, like, go on their website, ACS Diagnostics, and check out all the testimonials. It's incredible how many testimonials they have, and it's all mostly older people that were going to go in for heart surgery of some sort that never had to go. It's incredible. So, yeah, the heart surgery is quick. This is 35 to 37 treatments to totally rejuvenate, replenish, replace,
restore
your
cardiovascular health and the system.
So, like, you can be 90 years old, do this for 35, 37 treatments, and you'd have the cardiovascular system of a healthy 20-year-old.
Without all the scar tissue that you would get from going under the knife. Because the scar tissue is causing the blockages, which is what's causing half the issues with circulatory. So
it's all about blood flow. It's all about the blood flow. And if the blood flow is not good, how can the body possibly be healthy? Another interesting fact is this machine actually helps to pump the lymph better than any other treatment. So think about any lymph drainage issues people have. This bed can help people with lymph drainage, lymph issues.
Mm-hmm. The stagnation of the lymph.
Yeah. Basically, it refreshes your cells. Sorry. It refreshes your cells. It refreshes your tissue. And then if you add in our little baby Avicin over here, that increases your microcirculation by 66%, which opens up more of your vascular system. It also puts you more in a...
It puts you more in a parasympathetic state as well. So it's just a nice adjunct to relax while you're in the bed. Gives you something else to focus on rather than...
I like that it keeps everyone's hands busy, because we have the one side where you have your pulse monitor on it.
Got the pulse oximeter on the one finger.
And your other hand's trapped in that machine, so you can't play around with your phone. You have to focus on actually helping yourself heal.
Yeah.
So.
And then we always put some nice, usually some nice relaxing music on. We like to stick with frequency music that's really high vibrational, that's healing for people to focus on as well. It's truly relaxing, you know, after the first couple of sessions. Usually it's the first one where people are a little bit, you know, the heart rate's a little higher. People don't know what to expect. You know, is this going to hurt me rather than help me? There's all these questions going on in their heads. And so I've found, at least, that the first time people are on the bed, the heart rate's a little more erratic and people are a little bit more...
anxious.
Yeah, a little more anxious. But after that, I mean, day 2... people are much more relaxed because they understand now what it's about, and they can get into that parasympathetic state a little easier.
We do use noise canceling headphones, so it's awesome. Like, you can't hear anything; you just feel your body doing this.
Mm-hmm. And even that becomes quite relaxing over time. Yeah. You know, once you can get in your breath, once you can release some of those blockages, because that's where you get the erratic. Heart rate sometimes is when there are blockages that need to be worked through. So the heart rate can elevate a little bit, and as the body gets used to having the pressure of the blood traveling through, it all regulates. And you know, sometimes by 2 or 3, you get into a really great rhythm where your heart rate can. I mean, Jason's can go as low as in the low 50s or.
I had it down to 44 in one treatment, which is crazy. Which
is indicative of really good cardiovascular health, which is what you want. You know, the higher your heart rate, obviously, the less healthy your cardiovascular health is.
Yeah. Now we had some other questions. I'm just going to grab my iPad. So I know one of the questions was, how many treatments till we're going to notice something different? And I think we both agree it's right around that 10 to 14 range.
I would say probably, yeah. And it really depends on what your ailment is, what you are expecting, or what you're hoping to get from it. Is that you just have cold hands and feet, and that you want to increase the circulation, you know, or is it a brain fog issue, or is it because you do have heart problems, and you need that full treatment? You know, it's going to be case by case for sure. But I would say that, that 10 to 12 range is where you really notice the differences for sure. But I, after one treatment, you know, had the tingling in my back that I, you know, was completely calcified. So after non-surgical treatments, I could actually, you know, feel blood flow back in that area. So for me, it only took the one treatment to feel a difference in my back. Basically, at the end of the day, if you got questions regarding you using this bed, call us 403-200-3133. We're happy to
answer questions specific to your circumstances. Sorry.
Or how to get rid of a bad cough.
Which I'm going to go to bed after this. Because I haven't been able to use it all week because I wasn't sure if I was contagious or not, so I stayed away basically. I know I'm not now. So one of the other questions I got was COPD. Where's the question now? What increase in oxygen can a COPD client expect? And the response I got was COPD is a different mechanism, but the patient's whole body will have increased oxygenated blood flow to all organs, tissues, etc. I do not believe it will change the COPD, which makes sense, but should have a positive effect on the O2 measurements. So that was Michelle asked that question, so hopefully that helps you, Michelle, with whoever that was pertaining to.
And once again, even with COPD, I really feel like you're increasing that that oxygenation, and you're increasing the into the lungs. So how can that not benefit a client with COPD? I mean, I truly believe that they're not allowed to say that it's going to cure, which is totally fair. But I would imagine that this therapy would definitely help an individual with COPD.
Yeah. Another question was, where does the plaque from arterial sclerosis go with the cardio med bed? Is there a risk of plaque embolism? And the response I got to that was the arterial sclerosis should not go anywhere. The ECP, the bed, over time will mimic the natural occurrence of collateral vessels. These vessels deliver more blood flow per oxygen in the area of the heart and body that may be experiencing low flow. A person with a history of embolisms may be contradicted, but I have not seen or heard of adverse events due to embolisms in practice. So again, if you need more information on that, reach out to me. I'll connect you with our person at ACS, and we can get a more detailed answer based on your specific situation. And then the final question I got for this week on the cardio med bed was, can the cardio med bed fix arterial flutter and fibrillation? And the the answer was there is no clinical evidence of fixing AFib. But the Cellsonic, I was told, because I checked into it, that the Cellsonic, we can do stuff with that to help with AFib. So hopefully that answers those questions. Again, regarding the Cellsonic and AFib, I can discuss that specifically with this patient. Just going to see, there's a few people on here, just going to see if there's any questions I missed. Hey Liz, how's it going? Hi Lori. Darlene, Amber, Ed, great to see you guys. Hi Lisa, Terry, Laura, and Kim. Awesome. Yes, thanks Michelle. Jason at marpaywellness.ca. My phone number. Awesome. Thanks Michelle. Elizabeth and Tracy. Okay, so there's no other questions it seems.
If anyone does have questions, if they're not watching the live and they're watching it later, please feel free to put your questions in the comments, and we will be sure to answer them as quickly as we can.
Yeah. Next week, because I'm dedicating every Tuesday to doing one of these, whether I'm healthy or sick.
Hopefully it's not me in your position next week.
No, well, she doesn't even know what I'm doing next week yet, but I'm going to talk about Perfect Day consultations, which she is the queen of Perfect Day consults. So hopefully she can be healthy enough to join me there and talk about her expertise with the Perfect Day consult. Because like I said, I keep it simple. I call people on stuff, but at the end of the day, we work together and it's pretty awesome. We've gotten some really good feedback on our consults and the responsiveness of our clients and just the changes in their lives. So I'm really excited to talk about that and share that with people. And then, from there, we'll start talking about other pieces of equipment. But for now, that's all I got. If there's any other questions. No. Okay, guys.
Thanks so much for joining us.
Yes, thanks a lot, guys. Again, phone number 403-200-3133 or email inquiries@marpaywellness.ca or just message us on Facebook. We're here. So looking forward to visiting with you guys, learning more about how we can help you.
And please, if you have anybody in mind that could benefit from the Cardio Med Bed, please share this video to their Facebook pages. We just need to get the word out that there are alternatives to surgery and to medications, because we've helped people get off of blood pressure medications just from using this bed as well. So
Yeah.
it's a great piece of equipment.
All right, guys, have a beautiful night. Talk to you later.
Bye.